This patented self-contained battery-powered disposable scope takes advantage of a closed circular tube with a beveled end to visualize the vocal cords. Unlike other scopes, the light is transmitted from the proximal end to the distal tip using a ring of LEDs. The light passes through the side wall of the tube as well as within the lumen of the tube to give the user maximal illumination of the target tissue, with minimal chance of light obstruction by blood or tissue. Even new video laryngoscopes have the same disadvantages as the traditional scopes, as the design is similar, not to mention that they are also very expensive and cumbersome to use and are generally not used outside of the hospital. This scope is ideal for trauma situations, both civilian such as after motor vehicle accidents and by the military for blast injury victims, for example. In these scenarios, a simple device that allows an excellent view of the vocal cords with maximal illumination via straight line of sight has a lower chance of obstruction, and this open view of the vocal cords can save lives. The shortest distance between 2 points is a straight line, and the scope's design with a narrower waist mid-tube allows the scope to negotiate the patient's anatomy. The scope is passed under the epiglottis, an easily identifiable laryngeal landmark to view the vocal cords. The beveled opening at the end of the tube sits parallel to the vocal cords, and the tip of the scope can be easily passed between the vocal cords if required to help open the airway further, to give the user the best view possible of the vocal cords. Another significant advantage this device has over other intubating laryngoscopes is due to the scope having a circular transparent tube with excellent illumination, which can be used to identify key laryngeal structures to give the user an idea where the vocal cords may be located. In trauma situations, the ability to see the vocal cords with surrounding blood and tissue trauma with a regular scope is poor, and oftentimes inexperienced users resort to a cricothyroidotomy, which carries a very high risk of failure and complication. With this device, the user has the ability to even intubate the patient awake in trauma situations, using air bubbles as a target to help identify the vocal cords. In the United States, approximately 24-25 million people require intubation for general anesthesia each year, and about 4 to 5 million people are intubated outside of the hospital setting in emergency situations. Even routine cases may be difficult, with patient obesity and anatomical differences, and anesthetic complications requiring immediate securing of the airway by other techniques. This device gives the user the best chance of intubating patients in any situation, in or outside of a hospital. Studies have shown that basic emergency medical staff intubate and place the tube in the correct position 50% of the time. Learning to intubate is not easy, and when the situation becomes difficult, such as with morbidly obese patients or after trauma, oftentimes very inexperienced people are required or called upon to perform intubation in these most challenging of circumstances, where even experienced providers would have difficulty. Internationally, intubation is becoming more commonly performed also, and some healthcare systems may have less than ideal equipment and training for intubation, especially in complicated situations. The patented Adroit intubating laryngoscope with its self-contained power source, straight tube design, and maximal illumination of the target tissue makes intubation easy, fast, accurate, and less complicated than other products, giving everyone, including novice users, the best chance of saving a life. Thank you.